What is up, everyone? It is C.W. Hall here, Charlie Whiskey, your host on the Kinetic Innovators podcast, and I'm pleased to have with me today Nicole Denham, Chief Clinical Innovations Officer for Depth Health, and we're going to be talking about their solutions that are taking advantage of the capabilities of artificial intelligence to be able to help hospitals and hospital systems better manage the flow of patients, the utilization of data that surrounds that patient from clinical to logistical. They have a number of solutions available for you. So, Nicole, I appreciate you taking some time to join me today.
Well, thanks for having me. I feel like I should have a cooler first name now since you
That's right. Before we jump into talking about Depth Health, just introduce the audience to your background. I know you've been in healthcare for a while, obviously active in the American College of Healthcare Executives. Talk about your background a little bit.
Yeah, so I am a critical care nurse by background. I went to Georgia State and practiced at Gwinnett Medical outside of Atlanta for a long time. And I was over cardiology, which put me with the biomed people a good bit in seeking solutions for my own health system.
CVICU on my
Yeah,
side too.
yeah. So I became a little bit of a data dork during my time there and just trying to deliver data to the providers so they could make really safe decisions from pretty early on in my career. And went on to form a consulting firm with my best friend. The firm is still around, Core Consultants. And got my master's degree from Penn State during that time because I wanted to really understand more the business side of healthcare than I did. And for 11 years did that, had the ability to work with so many middleware device companies across the country and working on how do we implement enterprise strategy for command centers, virtual care centers. And my mentor asked me to come work with him at Depth Health about a year ago. And I believed in him so much and the other co-founder that I left my firm and have stepped over into this role, but in a space that I've worked in for a couple decades now.
I find the concept of AI and what it's able to do fascinating, and watching it, the innovations that are happening with it and around it are very intriguing to me. Let's jump right into Depth Health, because I mean that's obviously the core around which you were built. So let's talk about Depth Health. How did it come to be, and who we're trying to serve?
Yeah, so the two founders are really innovators in the field of clinical grade surveillance. So they've worked together for 30 years together. One is a CTO, one is a CEO, and really worked on really agnostic middleware that really took whatever the infrastructure was of a health system from a clinical surveillance standpoint and put that in front of users for more the command center stuff. But they're really considered some of the innovators in the industry for that piece. And so really, and we were chatting about this a little bit ago, but Depth Health is using clinical insights for patient flow. And so that, I think, historically has sounded like a logistical problem, but I'm a nurse by background, and if the patient is not in the right level of care, there is either inefficiency or safety issues. And so it's really kind of the same problem they've been working through as experts for years. It's just kind of a really little bit more focused on patient flow. And so we're still using those clinical insights the same way.
And so as we were talking about Depth Health before we said, hey, let's jump on and talk about this, you described how it's looking at a number of different data points and data services, data sources, and it actually has some capability, lets us look back in time, see what we've done, what were the outcomes. Maybe there's some things that were a little different than we thought, lengths of stay or patient outcomes that maybe were influenced by some of this type of I guess logistical management of a patient's experience in a hospital, if you will. Talk about how this is utilized. It sounds like there's a dashboard of some sort that I'm going to be using in the hospital, both as a look back, but we'll be also using it today to see what's happening in the hospital today such that we can optimize it right now.
Yeah. So our client type is a health system. Our main user base is their patient access center or their virtual care center, and really the people who are responsible for patient flow. And we take basically our proprietary software, Racer, and we lay it on top of the infrastructure to be able to integrate agnostically with their EMR, their patient monitoring devices. And then there's a data mesh that kind of happens on top of that. And we're trying to solve what are the normal patient flow issues. So we think a lot about our cluster, which is the emergency room, where we might have boarders or people leaving without treatment. We have the telemetry area, step down areas, that is often a kind of a congestion zone because we don't have enough devices or beds that can care for that patient population. And we think about med surge, which could be used to kind of decongest. And so what kind of people who would be asking me like, how would we fit in? Why would we look at one of your solutions? We have kind of two entry points. We have what we called RAP. And essentially what we do is we take 100,000 retrospective patient journeys from a health system, and we say, hey, what did you already do? That's usually 3 to 6 months of data. And then deconstruct it down. We kind of look at our 5 core KPIs of kind of those areas we were talking about. And then we say, this is what you already did. And then we put our true solution on it, Racer. And then it says, this is what Racer would have done. So instead of doing a pilot, with everything that is involved with the pilot, we basically look at what you already did and we quantify it from not only a financial standpoint, but how many patients did this? How many patients did that? And what was the value that you lost? And then we project it out further and go, this is what you actually would gain from a value capture standpoint in a year. So we have RAP, which is kind of backwards retrospective, and then we have Racer, which is real time.
And what are the key indicators that you're looking at? You said there's 5.
Yeah. So we have reduce emergency room leaving without treatment, LWAT is what it's called, ED boarding time, optimizing ESI 3 over triage. So essentially, did we say you were sicker than you were? Reducing the cardiac telemetry overutilization. And then lastly, unnecessary hospital transfers, the ones that are inside of a health system. So maybe we had services at this satellite hospital, but we still sent you to the main kind of mothership hospital.
So it sounds like there's some financial impacts from a number of different directions. It's going to impact my CAP scores on some level. I'm not laying around in the ER longer than I have to. My transfers make sense. I'm not sitting here waiting for something to happen quite as often. So patient satisfaction obviously going to be impacted. Some clinical outcomes that you're describing, that if I'm optimally placed in the level of acuity that I need, then obviously my condition is going to be better managed potentially by that. Talk about some of the impacts that make this make sense for us, because obviously there's going to be some kind of licensing fee or
Sure.
cost associated with your solution. Why does it make sense?
Yeah, so that's a great question. So there will be a lot of soft ROI in there that it's maybe harder to put a financial number on it, but from the very beginning, especially if a client goes through the RAP process with us, then we're going to quantify their current state no matter where they start. So we're going to quantify that clinically, organizationally, and financially. And in fact, our executive view, we talked about the patient access being our main user. Our executive view is actually going to have real-time performance embedded inside of their login. So we're going to have every user involved with performance. We're going to use kind of a Baldrige aligned model to where we're really looking at performance embedded. And then we're going to use those 5 KPIs because they're easier to quantify from a financial standpoint, but there will be all of those other pieces that you talked about. So a health system might come to us and say, hey, well, for example, we have one right now that said, hey, our internal transfers are a problem. We can't even we can tell you how many we're transferring in and out every month, but we can't tell you which provider it is, or maybe who the biggest offender is. So some of this is just a simple awareness of what they're already doing. And then being able to break it down into pieces, deconstructing those patient journeys to say, here's how many hundred came from this. It was this many providers. It was this diagnosis. It was this ESI level. We're going to be able to quantify and find patterns to help us say the technology will provide that, but then this is a process issue, or this is a policy that maybe needs to be addressed, or a service line that needs to be stood up. So we're going to be able to kind of use those 5 KPIs to anchor us, but there will be a lot of kind of drendels, if you will, that will teach us a lot, especially through that executive view.
So the folks that are interacting with the Depth Health Solutions, is it primarily on that patient stay management, the care management people, more than the clinicians, or is there some degree that the clinicians will be also engaging with it?
Yeah, so our patient access centers are usually a mix of clinicians and bed coordinators who are non-clinical. So that will be our number one user group. The executive users will have the performance level. Also, they'll have ability to interact with Racer in surge and diversion. So when they need to stand up at command center where they're a lot more engaged, for the most part, that will be a mix of clinicians and executives, non-clinical too. Our third user group will be the nursing team. So it'll be potentially the charge nurses or the virtual nurses as well. So we really are going to impact the nursing teams, the executive teams, and the patient access teams. But on a day-to-day basis, we're really going to be changing the workflows for the patient access team the most. But the data points that the receiving charge nurse or providers or accepting charge nurses or providers are going to have is going to be very concise and a nice snapshot for them. So they can see why does Racer think this is where the patient should be routed. And really, as a clinician, we're all very science-based. So we want to see the data. And as somebody who charted on paper when I entered as a nurse, there's a little bit of mistrust on, don't tell me what to do, don't tell me. So we have definitely taken that into account, as not only has the platform been built, but how much transparency do we have for the providers to really feel that this is something they can trust.
I know that in today's healthcare environment, particularly at the hospital and hospital system level, the concept of health equity is important. And as I was looking at the Depth Health website, one of the things you describe on the site is there is some capability within your platform to be able to address that. Can you talk about that a little bit? I think it's called the harmonized layer.
Yeah. So the harmonized layer just looks really at the patient as a whole to make sure that we are using all of, the whole patient's clinical knowledge to make the decisions on everything. So that should be, completely from an equity standpoint should be equal. However, one thing that hasn't hit our website, but has hit our LinkedIn page, besides what you just brought up, is we are also part of a Rural Health Transformation Alliance now. So we're going to be looking at equity really from an access standpoint in the rural and kind of the critical access hospitals to be able to help them. If patient throughput is an issue with them, we're one of the tools in the toolkit. But if patient throughput is an issue for them and rural healthcare systems need to be as efficient as possible, we don't want them to shutter their doors. We want to be able to come in, help them get the funding that is, available through grants and different pieces, and accelerate them to funding. So the platform was built to be really patient-centric from an equity standpoint, but also we are looking at how can we provide these services and be able to get these health systems to get dollars that are allocated to them so we don't close access to a whole community.
Well, I know that I've got you joining me today in the middle of the day. Before I let you go, are there any other points that the listener needs to understand about Depth Health and your solutions before I let you go?
Yeah, it's been really interesting with like you said, my involvement with the American College of Healthcare Executives. I've had executives reach out to me for one of the 5 KPIs. So I want to drive everybody to our website, depthhealth.com. There's 2 H's in there to look at what are we doing? So on our performance page, we outline those 5 KPIs, and I promise you, each health executive has liked one of them more than the other.
Yeah.
So happy to, if one of those five speak to you. Also, if you have a health system that is a rural healthcare designation, happy to talk to you about that. I would say patient throughput is an issue for every health system. We can always optimize, we can always be efficient, more so. And that really, at the end of the day, we want to help the provider and the patient. And we want to keep health systems, their doors open. So feel free to reach out to me. I'm on LinkedIn, Nicole Denham. Check out our website, and happy to connect to see what your pain point is and how we can specifically show you what we're doing with our current client base.
Depthhealth.com, all one word. As Nicole said, available on most of the socials, obviously on LinkedIn. Link up with them, get a look at the platform, see how they're leveraging AI to help you manage your patient flow and your outcomes as a function of that better, and see the good things that happen downstream of that for your organization. Really appreciate you joining me today, Nicole, and I look forward to catching up with you maybe a few months or a little further down the road, see how things are going with Depth Health.
All right, awesome. Thanks for having me. I appreciate it.
We'll see you all next time.